Hello guys, now we shall be discussing regarding the cartilages of the larynx. Okay, so our topic of discussion would be regarding the laryngeal cartilages. What are the different kinds of laryngeal cartilages you have got? Basically, we have got different types of paid as well as unpaid cartilages. For example, there are 3 unpaid cartilages. In the same time, there are 3 paid cartilages. Okay, so what are these 3 unpaid cartilages? So one cartilage is called as epiglottis. You know, epiglottis is also called as a leaf-like cartilage. Okay, the shape of the cartilage will be in the form of a leaf. Next, you have got the thyroid cartilage. All of you know, we have drawn a couple of times thyroid cartilage previously, and this thyroid cartilage is a shield-shaped cartilage. And third important one is your cricoid cartilage. Cricoid cartilage is a ring-like cartilage. Okay. Next, 3 paid cartilages. One is called as a arytenoid cartilages. Arytenoid cartilages. Next one is called as a corniculate cartilage, and next one is called as a cuneiform cartilage. Okay, so there are 3 paid cartilages as well. So 3 unpaid as well as the 3 paid cartilages over here. I will show you the pictures of all these cartilages, right? But before that, out of these 6 cartilages which you have, out of these, which of them are elastic cartilages? See, out of them, which of the cartilages are elastic cartilages? Now, when it comes to the elastic cartilages, the first one in the row is your epiglottis. Epiglottis is an elastic cartilage. Second important one is your arytenoid, not complete arytenoid, but the tip of the arytenoid. Tip of arytenoid. Third important thing is your cuneiform cartilage. Cuneiform cartilage. And fourth important thing is your corniculate cartilage. Corniculate cartilage. So these are the 4 important cartilages which are elastic in shape, right? So let us discuss all these cartilages over here. We have discussed about epiglottis, arytenoid, right? Or let me show you a picture also, and then let us go back. So this particular this is your hyoid bone. Okay, this bone is your hyoid bone. Beneath the hyoid bone, this particular cartilage you have got is called as a thyroid cartilage. Okay, beneath the thyroid you have got what? Cricoid cartilage. Okay, this is your cricoid cartilage. And where is the epiglottis? You see this cartilage over here. This is your epiglottis. Clear? This is your epiglottis. So whatever it is, I don't think so this picture is that clear to discuss all these cartilages. So let me show you one more important thing. So exactly here in this animation, what are the important cartilages you can see? Let us come back. Now in this particular animation, you can see the first important thing, right? You know, by looking at this picture, you understand that this is the anterior surface. Now within this anterior surface, you can very clearly see, I am going down, right? You can very clearly see this cartilage here. All of you can very clearly look at this particular cartilage, right? So this particular cartilage over here, is called as your thyroid cartilage. Okay, this is called as your thyroid cartilage. Now I am turning this back. Now when you are looking from the back, you see this entire cartilage which is shaded with the yellow, right? You see this cartilage, this is thyroid cartilage. So how is the thyroid cartilage? Thyroid cartilage is in the form of a shield shape, right? Beneath the thyroid cartilage, what cartilage we have got? See, this is a cricoid cartilage. So cricoid cartilage, look at the cricoid cartilage from down. See, isn't it ring shape? Yes or no? Right? So what I will do is, okay, let me look at this. Let me look at this in another view. What I will do is that I will remove the entire skeleton. Okay, so let me remove the skull completely over here. Right now, after removing the skull, look at the picture. Now what I am doing is that I am looking from the top. So if you are looking just only at the cartilages like this, so this cartilage is your thyroid cartilage like this, right? And if I remove the thyroid cartilage, the next cartilage you have is the cricoid cartilage. You see, cricoid cartilage is in the form of a ring, right? So let me put the thyroid cartilage back. Now what is the epiglottis? Where is your epiglottis? See, this cartilage over here is your epiglottis, which is leaf like. Okay, so this is your epiglottis, which is leaf like. You are getting it? So this is the epiglottis which is leaf like. So when I remove the thyroid cartilage, clearly, and when I remove these muscles also on either sides, now you can very clearly see where is this epiglottis. You see this epiglottis now? From the down, from the side, from the up, right? So this is your epiglottis. And down here, what is this ring shaped cartilage? This is called as your cricoid cartilage, right? So apart from this, we also discuss, see, one cartilage we discussed is epiglottis. That is, how many epiglottis is there? See, only one epiglottis is there, right? So can I write it as unpaired cartilage? Next, after the epiglottis, the next cartilage which we discussed was this one. What is this? This is your thyroid cartilage. Thyroid cartilage is also one. After that, down here, cricoid cartilage. Cricoid cartilage is also one. So these three, can I call it as unpaired cartilages, right? These three are unpaired cartilages. Then where are the paired cartilages? So when I see, this is from the anterior view, and now I'm looking from the back. Now when I'm looking from the back, when I zoom this picture here, this is your epiglottis. Sitting on the epiglottis, can you see small button like cartilages? Yes or no? See, you can see this cartilage, right? Okay, let me remove the epiglottis. See, I'm removing the epiglottis. Again, I'm putting the epiglottis back. Now I'm removing the epiglottis. When I remove the epiglottis, from the side view, can you see three cartilages over here? See, this is one cartilage. Yes or no? What is this cartilage name? Cuneiform cartilage. How many are there? Right cuneiform, and here we have got the left cuneiform. Two cuneiforms are there. It means it is paired. Next, what is this one? Triangular shaped cartilage. Right? To look at this triangular shaped cartilage, what should I do? I should remove this muscle. After removing, you can look at this triangular shaped cartilage here, right? So this triangular shaped cartilage is arytenoid. How many are there? Two. Between the triangular and arytenoid, one small cartilage here, you see a small stone like cartilage. This is called as corniculate cartilage. Clear? So now you understood where these cartilages are. Now what we will do is that we shall look at the cartilages over here. Okay, right. Now what we shall do is that we shall draw these cartilages here. So these are the cartilages which you have seen here. Now let us look at the anterior view and the posterior view. Anteriorly, we have got one cartilage which is in this form, shield shaped cartilage, and this shield like cartilage you called it as a thyroid cartilage. Yes or no? Now above this thyroid cartilage, you have got this particular thing over here, and this is called as what? This is called as your epiglottis. This is called as your epiglottis. And down here you have got one more interesting thing. This is called as what? This is called as your cricoid cartilage. Clear? So these are the three unpaired cartilages which you can see from the anterior view. Which view is this? This view is called as your anterior view. Anterior view. Now let us look at the posterior view. Let us look at the posterior view. In the posterior view, what are the important things you can see? See, I told you two small cartilages are there, like button like cartilages, and down here we have got another button like cartilages, and after that we drew triangular shaped cartilages, right? So what was the name that has been given to these cartilages over here? Let us write it down one by one. See, this cartilage over here is called as your cuneiform cartilage. Cuneiform cartilage. And this cartilage over here is called as your corniculate cartilage. Corniculate cartilage. And these cartilages over here are called as your arytenoids. Arytenoids, right arytenoid and left arytenoid. And obviously, you see the cricoid over here. The cricoid does not change. The cricoid is same. Okay. Now, what is this view? That is a posterior view. Now, if there is a muscle that is present between, your thyroid as well as a cricoid, this muscle is called as cricothyroid muscle. What is this muscle over here? This is called as cricothyroid muscle. What is the use of cricothyroid muscle? Cricothyroid muscle is useful to increase the pitch of your voice. Increase the pitch of your voice. Okay. Next important. You also see a muscle that is present between cricoid and arytenoid on the back. Okay, this muscle is called as posterior cricoarytenoid. Crico is cricoid, arytenoids are arytenoids. Posterior cricoarytenoid. Why posterior? Because it is on the posterior side. So this muscle over here is called as your posterior cricoarytenoids. Okay, posterior cricoarytenoids. Next important thing is that all the way from the thyroid, right, to the arytenoids, you see a muscle that is attaching from the thyroid all the way from the thyroid till the arytenoid, you see a muscle here, right? So this muscle that is going from anterior to the posterior, anterior, this is posterior, from the front it is coming onto the back. So this muscle is called as cricothyroid muscle. What is this muscle? This muscle over here is called as cricothyroid muscle. Cricothyroid muscle. Now what I am doing is that I am dividing this cricothyroid muscle, okay, into two groups. One is called as the anterior, another one is called as the posterior. This anterior part of the cricothyroid muscle, whatever is there, this will tense the vocal cords. It will contract and tense the vocal cords. That is why this is called as a tensor of VC. VC matlab vocal cords. The posterior cricothyroid muscle is a relaxer. It relaxes the vocal cords, right? So anterior cricothyroid, anterior portion of or anterior part of cricothyroid causes tension of vocal cords, whereas the posterior one causes the relaxation of your vocal cords. Okay, right. Now after discussing the muscles, let us discuss what is the nerve that is innervating these muscles over here. Okay, so before I completely go into details of the muscles, one small introduction I want to give it to you, that you know that these muscles of the larynx are supplied by your vagus nerve. So here we have got the right vagus nerve, and here we have got the left vagus nerve, right and left. This is your right vagus nerve, this is your left vagus nerve. Okay. Now what is happening over here? What is happening over here is that from the right vagus nerve, you see a nerve. This is right vagus, this is left vagus. From the right vagus, you see a nerve that is coming, right? So this nerve over here is called as superior laryngeal nerve. What is this? Superior laryngeal nerve. And this superior laryngeal nerve is in turn divided into two important nerves. What are those two important nerves? One is called as external laryngeal nerve, another one is called as internal laryngeal nerve. One is called external laryngeal nerve, another one is called as your internal laryngeal nerve. Next important thing is that there is an other nerve that is coming down, right? So this particular nerve is called as a recurrent laryngeal nerve. What is this called as? This is called as a recurrent laryngeal nerve. So remember one thing, recurrent laryngeal nerve is a branch of inferior laryngeal nerve. Okay. So this is your recurrent laryngeal nerve. Now this recurrent laryngeal nerve, what will happen is that here you have, let us say, here you have got an artery. Okay. So there is an artery over here. There is also another artery over here. Okay. Not at the same level. Let us say there is one more artery over here. Okay. So this artery over here is called as the right subclavian artery. This is called right subclavian artery. And this artery over here is called as your arch of aorta. This is called as your arch of aorta. Now what is happening over here is that this right recurrent laryngeal nerve, whatever is there, this recurrent laryngeal nerve will take a U-turn and then it will go up like this. Right? So why am I telling you this? Because if there is any problem with the right subclavian artery, or if there is aneurysm of this artery, which nerve will be compressed? The recurrent laryngeal nerve will be compressed. In the same way, you see another nerve here, right? So this is also a recurrent laryngeal nerve, but on the left side. This recurrent laryngeal nerve is longer. Why? Because it has to go all the way down and then taken up like this around your arch of aorta. So if there is aneurysm of arch of aorta, which nerve will be compressed? Left recurrent laryngeal nerve will be compressed. Okay. So this is one of the important thing which you need to know. Yeah. Right. Now let us discuss the muscles over here. So just look at this particular picture over here. From the side view, this bone over here is your hyoid bone. And this particular bone over here is called as your thyroid cartilage. And down here you have got your cricoid. Okay. So this is your hyoid, this is your thyroid, and this is your cricoid. This is your cricoid. Now between the thyroid and the hyoid, this particular membrane is called as thyrohyoid membrane. What is this membrane? Thyrohyoid membrane. With the red, whatever I am drawing is the muscle. The muscle that is present between the thyroid and cricoid is called as cricothyroid muscle. Okay, let me write it down. See, this membrane is called as the thyrohyoid membrane. Okay, this membrane is called thyrohyoid membrane. Next, this muscle is called as cricothyroid muscle. This muscle is called as your cricothyroid muscle. Now, next important thing over here is that here let me draw one very important nerve over here. So you see this is called as your vagus nerve. Okay. Now from this vagus nerve, what were the branches I told you? First branch was your superior laryngeal nerve, right? So let us say this particular branch which is coming out, let me draw it with the same color. So this particular branch which is coming out is called as your superior laryngeal nerve. What did I tell you? Superior laryngeal nerve will divide into both external laryngeal nerve as well as internal laryngeal nerve. So it is dividing into two. One is called as your internal laryngeal nerve. Okay. Another one is called as your external laryngeal nerve. So this one is called internal laryngeal nerve and this is called as external laryngeal nerve. So what is this internal laryngeal nerve? Internal laryngeal nerve is a sensory nerve. Okay, where is the sensory nerve supplying? It is supplying to your thyrohyoid membrane. What is this external laryngeal nerve? External laryngeal nerve is supplying to your cricothyroid muscle. Okay, next another branch here which we discussed was, what was the branch which we discussed down? We discussed another branch here. Okay, let us look at this, that is recurrent laryngeal nerve. So this branch over here is RLN, recurrent laryngeal nerve. What does this recurrent laryngeal nerve do? It will supply all the muscles, specially speaking intrinsic muscles, all the muscles of the larynx except cricothyroid muscle. Why? Cricothyroid is supplied by external. So that is why leave cricothyroid, remaining all cricothyroid muscle. Remaining all are supplied by a recurrent laryngeal nerve. And remember one thing I told you, cricothyroid muscle is responsible for what? To maintain the pitch of the voice. And recurrent laryngeal nerve, I am telling you, one side of the recurrent laryngeal nerve, two sides you have got recurrent laryngeal nerve, right? One side of the recurrent laryngeal nerve is damaged. Can I call it as unilateral damage to the recurrent laryngeal nerve? Yeah, one side of the recurrent laryngeal nerve is damaged. This would lead to hoarseness of voice, just hoarseness of voice. If both the sides the nerve is damaged, this will lead to complete aphonia, no voice. Keep that thing in mind. So, unilateral recurrent laryngeal nerve injury and bilateral recurrent laryngeal nerve injury. Unilateral recurrent laryngeal nerve injury will lead to hoarseness of voice, whereas bilateral will lead to complete aphonia. Aphonia, complete no voice at all. Okay, so these are some of the important things which you need to know. Right. So these are some of the very important things which you need to know regarding the laryngeal cartilages, guys. So thank you so much for watching my video. Goodbye.